We use a lot of gels in urology. In the outpatient setting, we use them for examining the patient in the clinic, for doing rectal examinations on male and female patients, and for doing vaginal examinations on female patients. And also if we're using a speculum, we would use gels in the outpatient clinic as well. In inpatient procedures, we use them to grease the instruments, both in outpatient procedures like with a flexible cystoscope and insertion of catheters, and in surgery with the inpatients, they're very important with greasing the instruments such as the cystoscope and the resectoscope, which we use for resecting prostate. Today I'm going to show how to lubricate a flexible cystoscope. This is a standard flexible cystoscope such as we would use for male and female patients. The lubricant that I'm going to use comes in 3 types of packaging. There's a sachet and a tube, which are both sterile and single use, and also a double wrapped tube for use in the sterile field. I'm going to demonstrate with the sachet today. So you just squeeze the gel away from the end and then rip it straight across, and then squeeze it along the end of the scope, and you can see that it's nice and viscous and adheres well to the instrument as I put it on. And then you can just lift the scope and wipe that around, make sure the whole scope is nicely lubricated for ease of insertion and manipulation during the procedure. We use gels for patient comfort so that the instrument's introduced smoothly with no dragging on the sensitive mucosa. Once the instruments are in situ, it's very important to keep that lubrication between the instrument and the lining of the urethra so that there's no damage, any torquing or tearing of the delicate tissues during the procedure. For instance, when we use the resectoscope to resect a prostate, that's a longer procedure, and if there isn't sufficient lubrication between the instrument and the lining of the urethra, then there can be problems post-operatively with development of urethral stricture. We have a resectoscope here, which I'm sure you're used to seeing. These are used in main theatre for resecting prostates and resecting bladder tumours. You can see that the drainage holes here would be quite rough as they pass through the urethra, and although we have the obturator in, there's still a number of ridges which could catch on the mucosa and cause trauma. The lubricant comes in 3 packages. There's a sterile single-use sachet and a sterile single-use tube. The tube also comes double wrapped for use in the sterile field. Today I'm going to use the middle tube. So you unscrew the lid and you can see that it's sealed inside for sterility, and there is a point in the cap for piercing the film. And then we want to cover the resectoscope, covering the holes and the ridges, and you can see it's nice and viscous and it adheres well. Once it's on, you just wipe it around so that you get good lubrication for ease of insertion. When I'm looking for a gel to use, I would want that gel to be quite gloopy so that it doesn't just drip off the instrument. It needs to be sterile so that it doesn't introduce infection into the patient. A urinary tract infection is always a possibility after a urological procedure. But they can be very disabling for the patient. In the elderly population, they can cause confusion and lead to admission to hospital. So we are always very interested in decreasing the incidence of infection. It's important to have a single-use gel because you don't want to risk cross-contamination by using the same pot of gel for more than one procedure. The gel also needs to be clear so that it doesn't obscure the view through the urological instruments. And we always use water-based gels. We know that oil-based lubricants can degrade rubber, and for that reason they're not recommended for use with condoms, and obviously in urology we don't want to risk degrading the gloves or the catheters that we're using, and so we would always choose a water-based lubricant. Some gels have lidocaine in them, which is a local anaesthetic. Evidence as to whether that is useful is split. The lidocaine has an onset of action between 3 and 5 minutes, and in day-to-day practice, those gels actually are mainly used for their lubricant action. I can't imagine not using gels in my work. I think that the patients would have much more discomfort, both whilst I was actually putting the instruments in and also after the procedure. The procedure themselves would be much more difficult because the urethra tends to cling to the instrument, making manipulation during surgery much more difficult. In upper tract surgery, where we're having to introduce wires and laser fibres into the very tiny ureter, again we need to grease those fibres so that they pass through the instrument without damage.